Dear colleagues, I'm Christoph Diener from the medical faculty of the University Duisburg-Essen in Germany. And in this video, I would like to summarize my subjective selection of the 12 most important studies and publications in 2024. Let me start with dementia and Alzheimer's disease. The Lancet Commission on Dementia published a great review paper on all aspects of dementia, and they identified 14 potentially modifiable risk factors and comorbidities which have an impact on either the incidence or progression of, for example, Alzheimer's disease and dementia. At the same time, we have now for the first time approved therapies, monoclonal antibodies against beta amyloid for the early stages of Alzheimer's disease. This therapy is very expensive. Expensive in terms of initial diagnosis, using the therapy, follow-up, and so on and so on. And I ask myself whether this money would not be much better spent in setting up community health centers in areas which have a high risk of dementia and provide people there with education by nurses in order to identify and to treat in a good fashion modifiable risk factors. My next topic is again dementia, and it is the possible association of herpes zoster infection and dementia. There are population-based studies which indicate that herpes zoster infections increase the risk of dementia by about 20%. And we also have data from observational population-based studies that vaccination against herpes zoster might decrease this risk. And a recent study showed recombinant vaccines are more effective in this respect than the live vaccines that were used in the past. Another topic is long COVID. This was for a long time a controversial issue, and now a number of health authorities accepted this as a new disease and diagnosis. And we have now large studies showing that there are many differences between people with and without long COVID in terms of proteomics and in particular in the area of cytokines. Now, the combined GIP-GLP-1 agonists like tirzepatide are clearly effective in diabetes mellitus and obesity. And two new studies have shown that this drug is also effective in obstructive sleep apnea syndrome. And this is interestingly independent of the weight loss. So there is obviously a new treatment for sleep apnea disorders. Now, biomarkers play a more and more important role in a number of inflammatory and degenerative neurological diseases. One example is multiple sclerosis, where now we have a number of interesting biomarkers. The research group in Münster in Germany, they identified people with early MS and followed them for 4 years. And then they created clusters of a large number of biomarkers to identify 3 specific endophenotypes which have typical immune signatures. And one of these phenotypes, for example, predicted whether patients would respond to beta interferon or not. And I think in the future, this is the end of single biomarkers. We will need to use these very complicated immune signatures to identify patients who might respond differently to different treatments of MS. Now, as you know, all studies on neuroprotective therapy in Parkinson's disease failed. And this could partly be due to the fact that once a disease shows symptoms, it's too late to treat. And in Lancet, there were 2 important papers, classification papers, to identify people in the preclinical stage of Parkinson's disease. And the features that are proposed are genetics like whole genome sequencing, the detection of alpha-synuclein, for example, in skin biopsy or CSF or serum, the evidence of neurodegeneration in imaging, and preclinical symptoms such as REM sleep disturbances, olfactory disturbances, for example, constipation. In this context, there was a spectacular report of two patients with REM sleep disturbance in the prodromal phase of incipient Parkinson's disease. Both patients were treated with acetylcholine D-leucine, and their REM sleep disorder improved. But in parallel, interestingly, although the metabolic brain functions in functional imaging improved. And this would be the first time that one treatment could have an effect on the progression of Parkinson's disease. And now this has to be investigated in large randomized placebo-controlled trials. Let me move to migraine. British Medical Journal published a paper on 137 studies, a meta-analysis which looked at the treatment of acute migraine attacks primary endpoint 2-hour pain-free. The reference substance was sumatriptan. And it showed that elatriptan and rizatriptan are clearly more effective than sumatriptan. And the new migraine drugs, lasmiditan and rimegepant, are less effective. The most important aspect of this study is that elatriptan is very rarely prescribed for people with acute migraine attacks. Now we have new treatments for the prevention of migraine, and these are the monoclonal antibodies against CGRP. And there is a new approach, and these are antibodies against PACAP. PACAP also plays a role in the pathophysiology of migraine. And a proof of concept study showed that an antibody against PACAP can reduce the number of migraine days, short period. But this has to be now tested in a large scale trial. How can we find new drugs that work in glioblastoma? There's an interesting study from Zurich in Switzerland. And what these people did, they collected tumor tissue samples from 27 human glioblastomas and cultured them. And subsequently, they performed chemosensitivity testing of 132 drugs on tumor cells and non-tumor cells. And the substances that were working on the tumor cells were validated in vivo models. And one of these drugs that seems to work is vortioxetine, which is an antidepressant drug. And we are looking forward to large-scale studies, hopefully, which will investigate this drug in human glioblastoma. Finally, let me come to stroke. We have now 11 studies comparing tenecteplase and alteplase for thrombolytic therapy in acute ischemic stroke. A meta-analysis showed a small benefit of tenecteplase over alteplase, but there was no difference for mortality and the risk of bleeding. Tenecteplase has the advantage that it's given as a bolus, and it's particular, I think, useful for people who are transported to a thrombectomy center, but it's also a little bit more expensive. In the meantime, we have 16 randomized and observational studies on the efficacy and safety of endovascular thrombectomy in patients with large ischemic strokes. In this population, there is a benefit on thrombectomy in terms of functional outcome. There is no increased risk of bleeding, and therefore we can offer now a large range of patients with stroke thrombectomy as a very effective treatment. Dear colleagues, I'm Christoph Diener from the medical faculty of the University of Duisburg-Essen in Germany. These were my 12 most important studies and publications in 2024. Thank you very much for listening and watching.